Good afternoon, everyone. The ACT will enter into a 7-day lockdown from 5 p.m. tonight. This decision is as the result of a positive COVID-19 case in the Territory, a case that has been infectious in the community. We also have positive wastewater detections around the ACT. We do not currently know the source of the infection, but extensive investigation has been underway for many hours. This is the most serious public health risk that we have faced in the Territory this year, and really since the beginning of the pandemic. And that's why we will be introducing a strict lockdown in response. We've said throughout the outbreak that we've witnessed 300 kilometres up the road from Canberra and Sydney, that the lessons we learned from that and from elsewhere around Australia are that immediate and significant public health responses are needed to get ahead of this Delta strain. I've been making this point generally to the media and to the broader Canberra community for many weeks now, that if we did get a case in a scenario like this, that we would respond immediately and with a very significant public health response. This is the best path to pursue, to protect the health of the community and to avoid even more damaging and prolonged lockdowns and more significant economic consequences for our community. Now, this will be the first time that the ACT has entered into a lockdown this year, and really only the second time throughout the near 18 months of this pandemic. Now, during this time, Canberrans are asked to only leave their home for essential reasons. These essential reasons include essential employment, accessing healthcare, getting vaccinated is included in accessing healthcare. So please, if you have a vaccine appointment, please attend and get vaccinated. You are allowed to get vaccinated during this lockdown period. You're also allowed to get essential groceries and supplies and up to 1 hour each day of exercise. Our general guidance is to stay within your local area. So if you live in Belconnen, exercise in Belconnen, get your groceries, your essential supplies in Belconnen. Do not be travelling across the ACT for exercise or essential supplies. Similarly, if you are in Tuggeranong, Woden or Western Creek, the inner north, the inner south, Gungahlin, stay in your local area for your exercise and your essential supplies. Many people will need to travel outside of their district in order to get vaccinated or to work for essential purposes or to access essential healthcare. That is reasonable and understood. But where a service is available in your local area, please stay in your local area. Throughout the lockdown period, general retail will be closed. Hospitality venues will only be able to operate takeaway services. And our message to business is to discourage all browsing. If you are open for an essential reason in one of the business categories that enables you to trade in this time, what we need is people to come in, get what they need and leave. This is not an opportunity to go to Bunnings to browse. This is not an opportunity to hang around the local shops. Get in, get what you need and leave. That is the way this needs to work. The purpose of a lockdown is to stop people moving unnecessarily. The virus only transmits when people move around and come into contact with each other. So the objective here is to reduce the movement of people and to reduce the transmission potential of this outbreak. That's why we are going into a lockdown. Now more than ever, it will be critical for people to use the Check-in CBR app. This has already provided vital data to assist our contact tracers and our public health officials in responding to this initial situation. Now, we know from what we have been seeing around Australia, in New South Wales, in Victoria, in Queensland, in South Australia, in Western Australia, and going back a bit in Tasmania and the Northern Territory, how contagious this virus is and why it is so important that we follow the public health directions for the next 7 days. This is critical for individuals' health, for your own health, but to protect your family, your closest friends and the broader community. Now is not the time to be popping over to mum or dad's, or your brother or sister, or your kids for a family gathering. Please stay at home. That is the clear and simple message. The virus only transmits between people when we come into close contact with each other. Doesn't respect family bubbles, intergenerational. So what you need to do is stay just within your household. That's the very important and clear message. The public health directions also mandate mask wearing. This will be reintroduced to the ACT. We have done this before. When we last had a mask mandate, I asked everyone to hang on to your masks. You're probably going to need them again. Well, you will outside of the home. So in all settings, in all contexts, if you leave your home, you need to be wearing a mask, except if you are undertaking rigorous physical activity in that 1 hour of exercise, or for an appropriate medical reason, you cannot wear a mask. And again, we've discussed this at length over the previous discussions around the mask mandate. But if you leave your home, you are going out into the community and going to be anywhere near anyone else, when in doubt, have your mask on, and you must carry a mask with you. This is essential as a further risk reduction measure. Goes without saying, now is not the time to have friends over, to have parties. We really need this lockdown to be effective. And we have seen in other parts of Australia what happens when people do the wrong thing. No one wants to be here today in this situation, but we have one opportunity to stamp this out, and we all have a collective responsibility to each other to make sure we are successful. We're urging Canberrans who have any COVID symptoms to get tested. A new testing clinic is being established at the Brindabella Business Park, and the capacity and operating hours of the Exhibition Park Testing Clinic and the Western Creek Testing Clinic will be significantly expanded. We can run Exhibition Park 24 hours a day if that is necessary. We want to prioritise the testing though. There will be people who will be identified by ACT Health as close contacts. We need those people to be able to be tested quickly. So if you are contacted by ACT Health and required to get tested, please make your way as quickly as possible to the testing clinics. There'll be further detailed information on where and when you can get tested available online. We do expect, though, demand for testing to increase. On a normal day over the last 6 months or so, around 1,000 people have been tested. We are anticipating demand to increase significantly. That's why there will be more testing sites and why the testing hours and capacity will be significantly extended. But we are asking Canberrans to be patient. There will be a lot of demand, and we're asking people to do the right thing by their community at this time. Now, further details of the comprehensive set of arrangements that come into place will be available on the ACT COVID-19 website. We're also actively communicating all of the sector-specific information to the various peak bodies in the industry and business context, to the community sector, and through our ACT government communication networks. There'll be a lot of information available on the COVID-19 website, But I'll now ask our Chief Health Officer, Dr. Karen Coleman, to provide some further detail in relation to the specific cases and sewerage information, the exposure sites. Following Dr. Coleman, the Deputy Chief Minister and Education Minister, Yvette Berry, will outline the arrangements in relation to schooling, and then Health Minister Rachel Stephen-Smith will provide some further information. After that, we are all available for questions together with the Chief Police Officer. Thank you.
Bless you. Thank you very much, Chief Minister, and good afternoon, everyone. My name's Karen Coleman. I'm the ACT Chief Health Officer, and it's good to be with you this afternoon to help take you through what's going to be happening over the next 7 days at least. So, as the Chief has announced, we will be entering a 7-day lockdown from 5 p.m. today. The reason for this is that very late last night we were notified of some wastewater detections in our wastewater surveillance system, and then this morning we received a notification of our first positive COVID-19 case in the community for many, many months now. This lockdown will remain in place until 5 p.m. Thursday the 19th of August. And we've talked about this before. We need to allow a 7-day pause. We need to be able to collect the information. We need to be able to work through the situation, and we need to be able to get everybody to stop moving around and see if we can knock this on the head as early as we possibly can. So I'll just go through the case details at the moment for you. So this new case is a man in his 20s who's been residing in Gungahlin. At the moment, we are undertaking that intensive case interview and progressing our contact tracing. But we understand that this new case has spent extensive time in the community, and we are considering him to be infectious in the community since Sunday morning. He has visited a large number of venues, and I will just take you through the list of venues that we are aware of at the moment so that people can start thinking about if they were at these locations. If this is not on the website at the moment, it will be very shortly, and I encourage you to keep checking with the website, please. At this present point in time, all these venues during this period of time are identified as close contact venues. We are taking a precautionary approach. If you have been at any of these venues during the times listed, you must quarantine for 14 days. That is full quarantine, and you must get tested. Even if you get a negative test, you must remain in quarantine for the full 14 days. We also require you to complete the online form for this purpose, available on the ACT website. This will help us support you in quarantine, but also really help us to keep track of what's going in our community and assessing our risks. So I will take you through the large number of exposure locations now, starting from Sunday the 8th of August. So all of these are for Sunday 8th of August. From 12 a.m. to 4:45 a.m, Fiction Bar in Canberra City. From 10:30 a.m. to 1 p.m, the Church of Pentecost, 19B Irving Street in Woden. From 2 p.m. to 2:20 p.m, Freedom Furniture in Fyshwick. From 2:15 p.m. to 2:35 p.m, JB Hi-Fi in Fyshwick. From 2:35 p.m. to 2:50 p.m, TK Maxx in Fyshwick. So I think what you're seeing here is that Canberra Outlet Centre is implicated, and we're assessing that there is a risk period between 2 to 3:30 p.m. on that Sunday the 8th of August. For those people who were at the Canberra Outlet Centre during that period of time who were not in those specific shops, we just ask you to closely monitor for symptoms. If you become unwell, isolate and get tested. Braddon, the Assembly Pub, between 9 p.m. and 9:30 p.m. Sunday evening. Then we move through to the 9th of August. From 7:30 a.m. to 1 p.m, the Stockade Training Centre in Fyshwick. 10th of August, from 9 a.m. to 11 a.m, the Stockade Training Centre. From 10:30 to 1 p.m, the Urban Pantry in Manuka. On the 10th of August again, 11 a.m. to 12 p.m, Harvey Norman in Fyshwick. And the final day is the 11th of August, from 11:10 to 11:30, the North Canberra Business Centre in Mitchell. From 11:30 to 11:45, Companion House in Cook. From 12 p.m. to 12:15, the Capital Chemist in Kingston. And from 12:15 to 12:40, the Coles in Manuka. So please, I run through those today verbally, but I really, really beg all of you to continue to check back on our website. These will change, as you've seen from other jurisdictions, as we go through further interviews, we learn more details, people remember more. We are also having access to the check-in CBR data. So thank goodness this gentleman has been using the check-in CBR religiously, and we are working through that data at this point in time, and that will assist us in contacting and giving people the heads up if they have been there. So I think the final thing on that I will just say is that at this point in time we have no source or no link for this case. This is one of the reasons why I've recommended and we are going into a lockdown for the next 7 days. So we will be conducting an intensive case investigation, looking back for the 14 days prior to when we thought he was exposed to see if we can identify where this has come from. We are also getting the whole genomic sequencing conducted and hope to have that back by lunchtime tomorrow. That will assist us to identify where, hopefully within the Greater Sydney outbreak, this linkage has occurred. So I think that's all I have for the moment. Very happy to come back for questions, and I'll now hand over to our Deputy Chief Minister. Thank you.
Good afternoon, everyone. I'm here to talk about how public schools will operate over the next seven days during this lockdown. So from tomorrow, if you can keep your children at home, you must keep your children at home. If you are an essential worker, if you are experiencing vulnerability, or if for some other reason you just can't keep your children at home, then your children can still attend their local public school. Public school teachers will spend this period of time moving and planning for and transitioning to remote education, should that be required after this initial lockdown period. This means that normal schooling won't happen during this week. The Education Directorate has spent the last year developing and refining a home learning library, which has a whole range of resources organised by year group that is accessible for families in the ACT during this period of time. You can go to the Education ACT website, search home learning, and there will be a whole range of activities that are available there through that online resource library. Children who do attend their public schools will be supervised and supported to access these home learning resources during this time. Teachers and school staff, if you are attending school, you must wear masks. If you are a child under 12, we have a child under 12, they will not be required to wear a mask. If you have children attending school who are 13 and over, 13 years and over children must wear a mask. Public schools will also be checking in over the next couple of days and into next week with vulnerable families to ensure that they have everything that they need to be able to access this online learning library. So if they need access to devices like Chromebooks or access to internet services, that will all be provided by the ACT Education Directorate. We all knew that this lockdown was possible. And so the ACT Education Directorate, our public schools, indeed all our schools across all sectors in the ACT, have been planning for this. We've received feedback from our experiences last year. We've been working closely with our school communities, our school teachers, parents and PNCs, and we've been watching very carefully and learning from other jurisdictions as they've been going and experiencing lockdowns as well, on how their public schools are operating and the best way that we can support our school communities. For out of schools hours care and early childhood education, on the advice of the Chief Health Officer, these services can remain open during this snap lockdown for children who need to attend. But we are still encouraging families that if you can keep your children at home, please keep them at home. The mandatory mask wearing principles still apply to early childhood educators, and parents, and the Check-in Canberra apps will be available at those settings as well. The same applies for out of schools hours care. They can still remain open, but if you can keep your children at home, please keep your children at home. For non-government schools, it's important that for Catholic and independent school communities that they listen carefully and pay attention to communications from those schools. However, the ACT Education Directorate will continue to work closely with those school communities to ensure that the Chief Health Officer's messaging and that our approaches with regards to that are consistent. So I guess I just wanted to reassure all our school families in our public schools and across all our schools in every sector that our school teachers have been all preparing for this moment. None of us obviously expected it to occur so soon, and none of us really wanted to be in this space, but we are. We're fully prepared, and our teachers are ready to move to remote learning should that circumstance arise. And I understand the Health Minister is going to make some comments too now.
Thanks very much, Yvette. For those who don't know me, I'm Rachel Stephen-Smith. I'm the ACT Minister for Health, and I just want to wrap up with a few comments, including some comments for people who live in our local region. So my first comment to Canberrans is that this is a very serious situation, and we want you to take it seriously. But we also want you to stay calm and be thoughtful about your actions. We've already heard that we're starting to see some panic buying at our supermarkets. So, like every other jurisdiction has had to do, we want to remind you that supermarkets will remain open and that grocery shopping will continue to be allowed during this 7-day lockdown. So there is no need for panic buying, and our key message to people is please be patient, be kind with one another, and be thoughtful about the way that you respond to what will no doubt be a very difficult situation for many people in our community. The clear message is that the best thing you can do to protect yourself, to protect your family, and to protect your community is to stay at home as much as possible, to only leave your house for the essential reasons, and to ensure that you are wearing a mask when you leave your home. There are a number of reasons that you are allowed to leave your home, and they will be listed on the website, and we've heard them before. But my message is, do not look for a loophole within those reasons and an excuse to leave your home. If in doubt, don't do it unless it is absolutely essential. And of course, as the Chief Minister said, going and getting vaccinated, keeping your vaccination appointment is one of those essential reasons to leave home. The Chief Minister also indicated that we really need to ensure that testing is prioritised for those who most need to get tested in our community. We will see an increasing demand for testing, and we're opening a new testing site and we're increasing capacity at our existing testing sites at Western Creek and at Epic. But please do not turn up to get tested because you're anxious. If you have no symptoms and you haven't been asked to be tested by ACT Health and you haven't been in any of those identified exposure locations, staying at home is the best thing that you can do to protect yourself and your community. We really, really need to prioritise that testing for people who need it. But if you do have symptoms, absolutely go and get tested at the earliest opportunity as soon as you have the mildest of symptoms. If you've been in any of those exposure locations or if you've been asked to be tested by ACT Health, absolutely you must go and get tested. It is vitally important that if we have other cases in the community, which we quite likely will, given what we know about this case, that we identify those cases as quickly as possible and that our contact tracers can get to work as quickly as possible. Please be patient if you're going to get tested. We know we'll see lines. Please be kind to those who are doing that really important work of taking those swabs and testing our community. And more generally, please be patient and kind to one another as you're out and about, if you're going to get your groceries, if you're leaving home for one of those essential reasons. And on that note, I do want to thank the venues that have been named today. I know that this is a very fast-moving situation, and it's possible that some of the venues that have been identified as exposure locations won't have actually had much detailed communication, if any, from ACT Health at this point in time. So I do want to apologise to those venues that we've had to name those venues before we've been able to have conversations with everybody, but it is really important in this situation, particularly with the Delta strain of the virus, that we get that information out to the community as quickly as possible. So I also thank all of those businesses and venues for their patience, and I'm sure that they will work with ACT Health really closely as we work through what the requirements for those businesses and venues will be. Our health emergency team is trained and prepared to respond to this situation. They have been preparing for multiple scenarios for a long period of time. And they, I'm sure, will continue to do an outstanding job with their contact tracing, with their case investigation, and with supporting people who need their support. But they cannot do it alone. We all have a role to play. And I particularly want to acknowledge the role that has been played and will continue to be played by community leaders. We have really great communications channels with our diverse multicultural community and right across our community in the ACT. But I want to encourage you, if you're watching on Facebook today, if you're a community leader, please share this information with your community. It is vital that all Canberrans are getting factual information and are seeing this information and abiding by the rules. We know that is the only thing that is going to enable us to suppress this, to ensure that we break those chains of transmission and we don't have a curve to flatten here in the ACT. I also want to do a quick thank you to those who are already in quarantine. We already have more than 1,000 people who are in quarantine as a result of returning from COVID-affected areas across New South Wales. We're going to see with these exposure locations many, many more people being asked to quarantine or being asked to get tested and isolate. It is vitally important that if ACT Health asks you to quarantine or asks you to get tested and isolate, that you follow the directions of ACT Health. But they will be there to support you every step of the way. And I've certainly heard from my constituents who've had to go into quarantine how fantastic ACT Health has been in providing them with information and support that they need to sustain their quarantine. And we will also be providing support to people. We know that this will be tough for some people, and we're already going to be working with our community sector organisations to ensure that if anybody does need financial material support, or particularly material support in terms of emergency food relief, that we will be able to get that out to people. So we're already working on that, and I want to assure the community that if you need something, we will be able to get it to you. And finally, I just wanted to say something to people in our surrounding regions. So we know that there are people just outside the ACT border who are essential workers in the ACT or who need to cross the border for essential reasons on a regular basis. So for those people, you are part of our community and we need your help now. We need your help to minimise the number of people who are out and about and moving in the ACT, but we also know that you will need to cross the border sometimes for essential reasons. So I'm going to read out a set of postcodes, and I want to advise those people who live in these postcodes that there is a standing exemption for you to be able to cross the ACT border, but only for the essential reasons. Only if you're an essential worker or you need to come to the ACT to do your grocery shopping, or you need to come to the ACT, for example, to access medical services. If you don't need to come to the ACT, please don't do so. But if you live in postcode 2581, Gunning and Collector, postcode 2582, which includes Murrum Bateman and Yass, 2584, which includes Binalong, 2611, which includes Uriara, 2618, which includes Wallaroo and areas along the ACT's northwestern edge, 2619, which includes Jerrabomberra, 2620, which includes Queanbeyan, Googong, Carrabah, Sutton and Gundaroo, 2621, which includes Bungendore, 2623, which includes Captain's Flat, or 2626, which includes Bredbow and Michelego. If you live in any of those postcodes, there is a standing exemption for you to be able to enter the ACT for essential reasons. But please make sure that you are carrying identification, because the decisions that we have made around the rest of New South Wales mean that ACT policing will be very vigilant in looking out for New South Wales number plates. So you either need to be able to demonstrate that you live in one of those surrounding regions and you're here for an essential purpose and be able to explain that to ACT policing, or if you're out from outside those regions, you will need to have an exemption to hand and to be able to explain your presence to ACT policing. So a call out to all of those in the local region. We know you're part of our community. We really need your help to abide by the same rules that Canberrans are abiding by and to absolutely minimise your travel into the ACT. And with that, I'll hand back to the Chief Minister.
Thank you, Rachel, and thank you, everyone. I spoke to the Prime Minister and Treasurer Frydenberg this morning prior to this press conference and have been able to enact the same business and community economic supports as have applied in the other states and territories where lockdowns of this kind have been put in place. The Prime Minister and the Treasurer were very supportive of those arrangements being put in place. It was a very straightforward discussion, and I'm pleased that we are able to enact the same arrangements that have applied for other states and territories. The further details in relation to those support packages, the COVID disaster payment, the business supports, information will be available again on our COVID-19 website and through the various Commonwealth Government websites where an additional page or link will be provided for support for ACT residents and businesses. So from here, we are available to take your questions. Every question you want to ask, we will be here to answer. So if we can do this in an orderly way, one at a time, that would be helpful. There isn't a time limit on this press conference up to a reasonable point. So I ask for your cooperation in that regard, but you will have the opportunity to ask a question. So if we can just do it in an orderly way. And let's begin by stepping up to the microphone on my right. Jasper.
Chief Minister, the ACT government has previously talked about regional border bubbles and putting measures in place to protect the ACT while taking into account the community that lives around it. Do you regret not moving faster to enact something of that kind, given the situation that we're now in?
No, I don't think it would have had any bearing on the situation. Whilst that offers and the public health directions offer a degree of protection, the nature of this virus and the nature of transmissibility and the fact that there would still have been thousands of Canberrans coming back home and still a movement of so many essential workers. If the thought was that you could somehow have a perfectly sealed Canberra bubble, that was never possible. And so that's why we have planned for this scenario. And so it was a false hope, as I've said countless times when asked that question. It would not and will never provide absolute protection against a virus of this kind. So the measures that we've put in place and have done so through the 18 months of the pandemic have been very, very effective. But no one in Australia has been able to completely eliminate the possibility of the virus coming into their jurisdiction. Now, even the island of Tasmania has been exposed at various points, even remote parts of the Northern Territory and Western Australia. So that was never a viable option to completely eliminate risk. You just cannot do that. And so the mechanisms that we've put in place have been very effective for more than a year. But this is a tough virus to beat. Next question, over on the left. Dominic.
Roughly how many close contacts are we looking at the moment? And given the transmissibility of Delta, will close contacts of identified close contacts also need to go into isolation?
I'll invite Dr Coleman to address that question.
Thank you. There are many close contacts. I can't give you an exact number at the moment, but as you can imagine from the large list of exposure sites that I've listed, we are still working through how many close contacts we have. So I can keep you up to date on how that's going. I think this is one of the reasons why we're very concerned about this situation and why we have gone to implementing a lockdown. We need to stop people moving around. We need to stop the risk of transmission chains continuing, and we need to ensure that we get the chance to identify every one of these close contacts and make sure that they understand what they need to do. Thank you.
Close contacts, do they also need to...
At this point, no. At this point, we're focusing on the close contacts. We'll make a risk assessment of the risk of transmission, and then we can talk to you about whether we think that there is any onward transmission risk. Thank you.
We'll go back to this side of the room. We'll just alternate either side. Yeah.
Chief Minister, just in terms of ACT's vaccination rate, it is a lot higher than the rest of the nation. Does that bring you any comfort? And secondly, you said that we've learned that we have to act hard and fast. What has New South Wales experience sort of taught you in your decision making?
Sure. Well, look, a higher vaccination rate does give a greater degree of protection to our residents. I think that's fairly well established now across the nation. So Canberrans have been outstanding in getting vaccinated. I think we are the only state or territory that has an age cohort, and that is everyone 70 plus, that has a first dose vaccination level of above 90%. And for some of the 5-year cohorts above 70 years of age, it's above 95%. So nearly everyone who could possibly get vaccinated has at least had a first dose in the over 70s. We also saw extraordinary take-up from my generation, Generation X, and those a little younger than me in Generation Y, when we opened bookings for vaccination. So that does help. But at the moment, we have a first dose rate over 50% and a fully vaccinated population of around 27.5%. But that's still nowhere near where we need to be to have much greater confidence around being able to manage outbreaks. So that's why we still need people to get vaccinated, and why I've been very clear today that a reason to leave your home in the next week is to get vaccinated. That is an excellent reason to leave your home. In relation to the second question, look, the pandemic takes us down new paths and into new directions, and things that we did not previously think could occur that now have occurred. We learn every single day around what this virus can do and how it can transmit. At the beginning of the pandemic, no one knew, and so we are just gathering evidence and information each day within the Australian context and globally. Because I've had one very simple rule and process to follow, and that is that mistakes can and will be made in a pandemic, but they shouldn't be repeated. So you should learn from other jurisdictions. And that's exactly what we've done and why we've applied the approach that we have. It's unrealistic to expect that every government is going to get everything right every single time. But we shouldn't be repeating the mistakes of other jurisdictions. And so we're learning, we're listening, we're watching, and we're acting accordingly as new information becomes available to us. To this side of the room.
Yeah, can I confirm, does this person have the Delta strain, and do you have a theory about how they got COVID? For example, was there travel outside the ACT? Is there a connection to the work of the Australian Parliament House? And how do you think this will affect the rest of the sitting of federal Parliament?
Well, I'm fairly certain it's not Parliament House related, so all the Federal Press Gallery people can breathe a sigh of relief at this point in time, but I'll invite Dr Coleman to provide some further information.
Thank you. At this point in time, I don't have enough information to answer that question specifically. I suspect it's Delta. I suspect the source is from the Sydney outbreak. We are getting the whole genomic sequencing conducted as fast as we can and hope to have that back tomorrow sometime, which will give us that answer. I have no thoughts about where it has come from at this point in time, but there's no reason to expect this person does not work or have any necessary connections or any of the exposure sites that appear to be related to Parliament House. Thanks.
And will it affect the current sitting?
They will currently be working through today what the implications are of a lockdown for Parliament House, and we're continuing to work, as always, with the Commonwealth and Parliament House on those implications. But we've only just working through this morning, so I'm sure that they'll be making announcements later on around that. Thanks.
Back to this side of the room.
Sorry, I've got another question about Parliament. So you've spoken with the PM this morning, beg my pardon, we're at the end of a parliamentary sitting week. Did you discuss this with Scott Morrison? Do you think the remaining August sitting week should be postponed for the time being? And would you like politicians who are here in Canberra from other states and territories at the moment to leave before the lockdown starts this afternoon?
Okay, so yes, the Prime Minister and I did discuss the implications for today's sittings. So I understand the Parliament isn't sitting next week, but it would be scheduled to return after that. Clearly, there'll be some decisions that individual MPs will need to make in relation to what they do during this lockdown period. For many, going home would be back into a lockdown as well, so probably makes sense for them to stay in Canberra. We don't know yet. I mean, you may. I've not been following the announcements of the other states and territories in relation to what restrictions they intend to put in place on people who've been in the ACT, but I imagine they will stand up the same sorts of arrangements that they've done otherwise. On Parliament itself, I mean, a starting principle is that you want your democracy to continue to function, but it really must be done in a safe way. So I think it's too early to say at this point what the next parliamentary fortnight will look like and whether it may or may not need to be postponed. So I'll take that part of the question on notice. We'll clearly have a view and be able to inform the presiding officers, the Prime Minister, the Leader of the Opposition and others around what the COVID situation is in the ACT, the conclusion of this 7-day lockdown period. And I think at that point you would be in a position to make a call on whether Parliament could or should sit for its next scheduled sitting. To this side.
Just one for the Cho, if that's okay.
Certainly.
Dr. Coleman, how confident are you that 7 days will be the circuit breaker, or I suppose stop it from getting out of control, given how hard and fast we've gone so soon?
Yeah. So the reason that we are locking down for 7 days is because we have learnt lessons and we understand the nature of the virus now and the rapidity and the risk of transmission. Look, we're not super people and I don't have a crystal ball. We are going to do our very best to work out how many people are at risk, where this has come from. Once we have some more of those answers, I will have a bit better idea about what the future looks like for us. I'm not going to lie to you now and make you promises that I won't be able to keep. That is what this is about. The next 3 days will be very focused on collecting further information, assessing the situation, and we'll keep you up to date as much as possible.
Okay, back to this side.
Chief, I have a few punter questions coming in. What's the go with construction? Is that still going ahead in the ACT? Childcare, can you send your kids to childcare if you're deemed an essential worker on the list? And why no singles bubble for people in the ACT?
Okay. Look, there is certainly information on each of those areas. We will have a measured approach to allow, for example, on a singles bubble, to allow for intimate partners and people who live alone to identify one other person who can be their bubble partner, for want of a better description, over this time. And there will be specific information in relation to the operation of childcare and construction. We are, it would be fair to say, we are leaning heavily into restricting those activities for the reasons that I have outlined around wanting to reduce risk and reduce the movement of people. But there'll be further quite detailed information Major Projects Canberra are convening a construction industry forum this afternoon to outline the range of measures and protections that we will have in place. Clearly, construction sites can't just stop like that. And there are some aspects of construction work that would be essential to continue for public safety reasons. And so we will have, as I say, a very measured but proportionate response in relation to activities there, and we can get the detail to you. On this side.
With the wastewater testing, are the levels high enough to indicate that there are definitely more than just one case?
Okay, it's an excellent question. I'll invite Dr Coleman to...
We're still learning about wastewater, and I think it's one of the things that we need to take into consideration over the next couple of days. 3 of our samples are positive, indicating concern in the northern and central part of the ACT. So in a way, I was very reassured this morning when I heard that our new case had come and spent time in those regions. So the story is coming together quite nicely. The levels are not significantly high, so they are over and above just being detected, but they are certainly not very high. The important thing will be monitoring the amount and the levels in more of a trending fashion. So at the moment, we're having twice weekly sampling taken, so we will be monitoring that very carefully, and we want to see that. It might go up a little bit while we see, because it lags a little bit behind, but then we will definitely see that start to come down, and that will give us an indication about how thorough we've got on top of our cases.
Back to this side. Look, if you've already asked a question, I would want people who haven't had the chance to ask one first, and then we'll go to second questions.
Thanks, Chief Minister. Can you tell us anything about the family of the confirmed case they're testing and isolating? And on the Doherty reopening plan, National Cabinet's plan for reopening, New South Wales going to starting to ease some settings at 60% must be an increased risk for the ACT. Are you concerned about Gladys Berejiklian's plan?
Okay, so I'll address the second part of the question and then invite Dr Coleman to talk about the family circumstance. So National Cabinet has had multiple in-depth discussions in relation to the Doherty Institute modelling. We've had the opportunity for hours and hours of Q&A with Professor McVernon, with our public health officials and with each other on what jurisdictions will do in response. We had deliberations over multiple meetings, had an in-principle agreement, and then further solidified behind that, that modelling and that approach. I've been concerned by some of the reporting of what jurisdictions will do that seems to be somewhat different from what I've heard and how it's been presented inside the National Cabinet room. So there's perhaps not the clearest of messaging and communication. As I understand the New South Wales position, it is not that they would end their lockdown and have no public health restrictions once they reach the vaccination targets that the Premier is talking about. My understanding of New South Wales' position was that they could look at the range of settings that they have once their vaccination rate reached those levels. But can I be very clear, it would be insane of New South Wales to remove all lockdown and public health restrictions. But I do not believe that is their position. And I've heard the Premier say that multiple times within the National Cabinet Forum, and whilst I can't watch every minute of all of her press conferences, I have been watching quite a bit lately, and I'm sure Premier Berejiklian has communicated that point to the media. But I do understand that there has been some confusion, and I've been concerned in reading various reports of what New South Wales are allegedly thinking or otherwise. But my understanding was based upon them making some minor adjustments to their lockdown provisions, not exiting out of lockdown altogether. What this whole situation demonstrates, though, is the absolute importance of vaccination and why it is so critical that more Canberrans, more New South Wales residents, more Australians get vaccinated. And that's what we need to focus on, in addition to, clearly, the public health measures that we have put in place to protect our community this week. I'll invite Dr Coleman now to talk about the case.
The case is a young man in his 20s. He has a partner and the partner is in quarantine.
Brett.
Yeah, just in terms of the testing clinics, we're seeing some Canberrans wait up to 5 hours. I know we've just opened the Brindabella testing clinic, or that will be open. Is there any capacity to ramp it up further than that? Would Canberra possibly be an option?
So we continue to monitor the situation in relation to testing capacity. What is the most straightforward thing in terms of being able to get increased capacity immediately is to have more staff and more operating hours at Exhibition Park and Western Creek. We also, it's August, it's winter in Canberra. We also need to ensure that our staff are able to perform the testing safely and that the community is not in a position where they're being asked to stand in the freezing cold. We want to avoid that as much as we can. So hence the opening of the additional drive-through facility. We will always be constantly monitoring our testing capability and looking at where we can expand. As I mentioned in my opening remarks, we can significantly extend the hours of operation at Exhibition Park, and we can increase the number, and we are increasing the number of staff available. But the message that Minister Stephen Smith gave, and I want to reiterate, is that we need to prioritise our testing on those who are identified as the close contacts and those who have symptoms. Do you want to add anything? Or, yeah.
So, as the Chief Minister said, we'll continue to monitor this, and one of the things that we have done at Western Creek is actually put someone outside under a little marquee outside the front of Western Creek so that they can take names and contact details and enable people to wait in their cars, so we don't have those big queues outside in the cold, as the Chief Minister indicated. We will also see, possibly over the next week, some changes to our frontline health services where we pull back some of our non-essential community services to enable us to free up staffing for testing, and we'll obviously continue, as the Chief Minister said, to monitor that situation and to respond as best we can, but we do continue to ask people for patience. We know that the demand for testing will be significantly higher than we've seen over the last few weeks.
Back to this side of the room.
On the borders and New South Wales residents coming in, is there going to be an increase in police sort of at the border, and how will that operate? Yeah,
absolutely. The Chief Police Officer has been waiting for this question. Neil, please step on up.
Thanks, Chief. Good afternoon, everyone. I think that the first thing I'll say is that compliance has continued throughout this entire pandemic. It hasn't stopped from a law enforcement perspective, and as the situation has continued to deteriorate in New South Wales, we've continued to stop vehicles at the border. In fact, we stopped in excess of 1,300 cars last week. So we've already made contact with our colleagues in Queanbeyan in relation to the fact that there will be a change in posture. I think we can expect people that have New South Wales plates coming across the border, noting there'll be less traffic, to be stopped. We expect them to have a driver's licence, and as the Chief Health Officer has stated there, and the Minister for Health, there are certain postcodes where exemptions are in place, and we'll continue to have those adhered to. But people with New South Wales plates can expect to be pulled over, and if they're not an exempt person or they don't have a reason for being in the territory, they'll either be turned around, they'll be fined, or they'll be arrested. It's pretty clear cut, and we'll continue to enforce the health directions in accordance with that direction.
Okay, now, is there anyone on this side who hasn't asked a question? Because Dom already has. No, we're all good? Okay. All right. Dom, your second go.
Thank you. Was the man vaccinated, or did he need medical attention for COVID-19? And is anyone able to confirm whether the man was a bouncer who potentially visited Sydney illegally?
I will ask Dr. Coleman to address the first part of that question.
So I don't have specific details at this stage on his vaccination status, but knowing his age, he would not have been eligible unless he had underlying chronic conditions. Thank you.
Okay. I don't have information on that at this point. Obviously, there's conversations and contact tracing and the like going on with the individual. I don't have any information at this point on that.
Have you been able to confirm, though,
So you just come up to the microphone, please.
Just following on that, though, have you been able to confirm if this man has been to Sydney or not? Wouldn't that be kind of one of the first questions?
I will invite Dr. Coleman to provide any further information she has on the contact tracing. Right. The question was, are we aware of whether the individual had been to Sydney?
No, I'm not aware that he's been to Sydney.
So that's a no then, he hasn't been? Like, I'm sure that would be probably one of the first questions that you ask.
So we are continuing to do our case interview. I don't have all the details from the case interview. We've been working very hard to get it at the moment. So we will, when we find out that information, I can tell you about it at this point in time. I'm not aware that he has.
So he hasn't said either way?
I don't know. I don't have a full report at this point in time. They're continuing to conduct the case interview. As you've heard Dr. Kerry Chant talk about, these case interviews can take several hours and several days. So I have not had my full briefing yet about what they've managed to get from the first case interview.
And is he being forthcoming with information? Obviously, there's quite a lot of venues and exposure sites. You mentioned that he'd been religiously using the check-in app, but is he being forthcoming with his movements outside of that?
The initial report that I've had is that he's been very, very receptive and working with us.
Paul, and then we'll...
Will this change the vaccine rollout in any way? For example, might you prioritise frontline workers in essential retail to come forward to get a Pfizer vaccine? Or do you think that the ATAGI advice about people of all ages in an outbreak should get AstraZeneca applies here?
Yeah. Well, look, we will assess whether any change is needed in that regard. Clearly, we are encouraging everyone to get vaccinated as soon as they can. The constraint on that is, as it has been throughout this year, vaccine supply. You can clearly see from the ACT's overall vaccination levels that pretty much every available Pfizer dose has been taken up in the territory, together with very strong AstraZeneca take-up as well. We will need to obviously assess whether there are any changes necessary. I'm not announcing a change at this point, but we will look at the situation. Obviously, anything more that we can do will be contingent on forward supply lines. I do note Moderna is scheduled to come online next month. I don't think it will be before then, though. So we'll do what we can within our available vaccine supplies. Back to this side.
Yeah, Chief Minister, just back on how this could affect federal parliament sittings. There's obviously dozens of parliamentarians in the capital at the moment. You and the Chief Health Officer, what's your advice to them specifically now if they're considering going home? Should they go home, or now that the lockdown has been announced, would they be a risk to their state or territory returning home?
Okay, well look, I don't want to be in the business of professing health advice to MPs at this point, based on the information that I have. I don't know whether any of them would have been to any of the identified exposure sites. A common sense response would be that if you were then and had been to any of those venues, then clearly you need to follow the public health directions that the Chief Health Officer has outlined. Let me just give a little bit more thought to whether we need to provide some specific advice to those MPs. With the greatest of respect to my federal parliamentary colleagues, they are not my highest priority at the moment. It's Canberrans and the community that I'm elected to represent. But I recognise that they are a very significant part of our nation's democracy. They and their staff are essential to the functioning of our government. If we have any further specific advice for federal MPs, staff and those who are working in Parliament House, we'll provide that through the presiding officers and through the party leaders. I think has been our practice in the past to ensure that the message is very clear. But look, the overarching position is that people should avoid moving around and avoid the risk of exposing others. So that would be a general statement. But let me get some more specific advice for federal MPs.
You mentioned Canberrans, Chief Minister. Just with this case obviously being a Canberran, it was touched on before, but is it actually an active avenue of investigation that this man had been outside the ACT into Sydney and had breached a quarantine order on return?
Well, look, if that is the case and the information that becomes available to us can confirm that, then clearly there are further consequences in relation to breaching public health orders. But I think at this point the important thing is to get the information and to have a sense from...
One of the most crucial
Yep. Well, it's not crucial to our immediate response. What's crucial is where the individual was, where the exposure sites are, who the close contacts are. There will be time in due course for further investigation of the exact point of infection, and obviously, as the Chief Health Officer has indicated, there's genomic sequencing underway. We'll get a much better understanding of that in the next 24 hours or so. I don't have every piece of information in front of me now, but you would understand, for obvious reasons, we needed to conduct this press conference now to provide information for the community that is relevant to their lives over the next 7 days.
Central, though, whether or not it's come into the ACT from Sydney, though, isn't it?
Oh, I think the odds are, given where the virus is circulating, that the seeding is going to have come from New South Wales. But until we can absolutely confirm that, I don't want to make preemptive judgments, but Dr. Coleman might be able to provide some more information.
No, I'd just like to make a comment on that, thank you. From a public health perspective, the most important thing to me at this point in time for the safety of the community is that individuals feel safe to come forward and provide us with the information about where they've been and who they've been with. I do not want, and I am begging you, please, do not make this about an individual and about the wrongs they've done before we can get all of that information and make the community safe. I want everyone to feel comfortable to come forward, to ask questions, to get tested and give us that information and not feel that they're going to get in trouble. So please, that is my beg for the safety of the community. Thank you.
Chief, you mentioned the business measures that will come back in. Do they include last year's commercial tenancies declaration to ensure that shops don't have to pay rent while they're closed?
Look, at this point, I don't think those measures have been stood up for short-term, as in sort of 7-day lockdown. So don't rule out that could be possible if it became prolonged. But at this point, no. It's I think if you want looking for some guidance on what it will look like, it will be not dissimilar to the 7-day lockdown arrangements that have been in place in other jurisdictions. Yes.
To now, you've been reluctant to shut off to most of regional New South Wales. All things going well at the end of 7 days. Do we snap back to where we were yesterday on regional New South Wales, or now are we heading into it's the border bubble?
Well, look, we have always acted on the advice of our Chief Health Officer, informed by information from New South Wales Health as it relates to the region immediately around us, and the guidance that's come out of AHPPC and National Cabinet. So I imagine we would continue to adopt the same evidence-based approach based on the public health circumstances. The risk points have been quite clear for some time, but it's too early now to make a definitive call on what would happen in 7 days' time. We will advise the community in advance of this 7-day period of what comes next, and I understand there will be a lot of interest in that, and it has very significant implications for the delivery of services in the ACT. I need to be clear that many of the staff who will be conducting the testing, doing the vaccinating and providing care to our community live just on the other side of the ACT border. So we are a region. We have to operate as a region. It may be that a further discussion with New South Wales around how we can better protect the Canberra region from what looks like being a prolonged situation in Sydney will be necessary in the coming week. A lot of that will depend on what else happens in regional New South Wales. I mean, I have noted and welcomed and fully respected the decision that New South Wales Health have been making every time there is a case in regional New South Wales to do exactly what we are doing now, to go into immediate lockdown. And that has been a layer of protection not only for those regional communities but also for us.
I appreciate the Health Minister outlined some postcodes which will allow free travel from our border towns. People travel from much further afield, especially to access critical healthcare in the ACT, especially from the South Coast. Will exemptions be available to those people as well?
For critical healthcare needs, yes, obviously. Canberra Hospital is the major tertiary hospital really in southern New South Wales. So in a case of critical need, of course.
Just one for the Deputy Chief Minister, Education Minister perhaps. Hearing this as of a short time ago that schools have only just been alerted that there is now going to be a principals conference at 2 p.m. to give them the exact details on how this will fully impact schools. Why haven't schools been briefed on how this will fully impact them until now?
I'll invite the Deputy Chief Minister.
Sorry, was that about whether or not school principals had been briefed?
It says that there will be a principals conference held at 2 p.m. today to give us exact details on how this will fully impact. Why have they not been fully aware until now then on the full impact?
They have been fully aware every step of the way following the lockdowns last year about processes and what we would do as a community to respond should there be a lockdown in the ACT community. That has been a regular course of action. As earlier this week, we were already planning for the unfortunate circumstance that we're talking about today. So this afternoon is about just tying all of that up, making sure everybody's on the same path. But we have been preparing for this, like everybody else in our community, every day. We talk about it every day. We've been planning to make sure that our families are supported every day in our schools. So this will be an ongoing conversation with our schools to make sure that everybody's being supported appropriately.
Did you alert the principals before making the announcement?
No, we didn't alert anybody before making this announcement. But as I said, there's been ongoing conversations with our school communities about planning for this event.
Yes, so final burning question. Anyone? Yes.
The Education Minister. Sorry.
Yvette? Hasn't been asked yet.
Just a bit more detail on how schools are going to operate. How will they be staffed? Will it be a sort of a skeleton staff on site?
Yeah, so for the first, for this period of the lockdown, teachers will be planning how that remote education will occur should the lockdown be extended after this first 7 days. So as I said earlier, there is a internet resource library that's available for families to access to do self-delivered education at home. Remote education won't occur during this first sort of 5 days of this lockdown period, but families will be supported to access that online resource library to do that self-directed education at home if they wish. Teachers will use this time to transition from face-to-face education to remote education, should that be required. That will put us in a good place if we need to go into a lockdown following this one, or maybe in the future if we need to go to a lockdown. But as you will understand, teachers have already planned their working weeks for this term and planned their classes for face-to-face education, so transitioning that online is an important part of the process to ensure that young people get the best possible education, however it's delivered.
Before and after school care, is that operating for essential workers?
That's operating as usual, however, we are in a lockdown, and so we are encouraging families, if they can, to keep their children at home. But it is available for families who need it, vulnerable families, essential worker families, but again, encouraging families, if they can, to keep their children at home.
How are we going to stop people fleeing to the coast from before lockdown kicks in this afternoon? Are there going to be roadblocks from policing or anything like that?
I'll invite the Chief Police Officer to address that, but clearly other jurisdictions will put in place a range of measures of their own in relation to ACT residents. Fleeing to the coast is not a good thing to do, as I think I've identified previously when we've had risk or cases in the ACT, that the health facilities on the south coast of New South Wales are just not there to support that community and indeed anyone who gets sick. So fleeing to the coast is a really bad thing to do, really, really antisocial. And if you're turning up on the New South Wales south coast with ACT number plates at the moment, If you're seen to be driving down there, I don't think those local communities will particularly welcome you. I suspect, though, there will be Canberrans who are already down there. So there will be some ACT number plates driving around. So this is, I guess, a point of balance, and I imagine those people are going to have a hard time in the next week, particularly if they want to be out and about everywhere in the South Coast. So people will know you shouldn't be travelling and shouldn't be leaving the ACT. But of course, if you are already at the South Coast, then, well, you are already there. But I'll invite Neil to talk more about the response.
Sorry, I didn't quite hear that question. So,
will there be roadblocks in place or turnarounds for people trying to, say, flee to the South Coast or to the New South Wales region farms and the like for the lockdown?
So, as I've already stated, we've already been in contact with our New South Wales colleagues, basically giving them a heads up that this was a likely outcome. So they're planning. I've been watching the news out there. I've already seen some jurisdictions that have declared the ACT a hotspot. I would suspect that's possible for other locations and maybe even New South Wales, and that would be the case then that ACT residents could not leave the ACT unless they're an essential worker across the border. Because not only do we have essential workers from New South Wales that need to come to the ACT, but there's obviously also essential workers in the ACT that, say, work at Queanbeyan Police Station and the like. So I really encourage people to look at the directions in place, not just for Canberra, but also for New South Wales, noting that we are surrounded by New South Wales.
All right, look, we're an hour 15 in. Is there anything else? So look, thank you. We will obviously be doing stand-ups very frequently, and as any new information becomes available, we will be communicating that to you, and appreciate your support in keeping the community informed over the next 7 days. Thank you very much.